Hello and welcome to CHD Wise, an education series for patients and families. My name is Becca Kalivas. I am the Education Director at Conquering CHD. This event is being presented live and the recording will be stored at conqueringchd.org. In today's episode, we welcome panelists from the Herma Heart Institute at Children's Wisconsin as we discuss the potential of precision medicine as a future treatment for congenital heart disease. I now have the great pleasure of introducing our panelists for this evening. Dr. Joy Lincoln is a professor of pediatrics at the Medical College of Wisconsin, director of cardiovascular research at the Herma Heart Institute, and the associate section chief of pediatric cardiology at Children's Wisconsin. She completed her PhD at the University of Durham in the United Kingdom and then moved to the US for her postdoctoral training at Cincinnati Children's Hospital in 2002. She began her faculty career at the Miller School of Medicine, University of Miami, and in 2011 relocated to Nationwide Children's Hospital in Columbus, Ohio. She was recruited to Milwaukee in 2009, where she continues her translational research program examining the etiology of congenital heart disease. Dr. Michael Mitchell is the chief of cardiothoracic surgery, the surgical director of the Herma Heart Institute, the S. Burt Litwin Chair of the Cardiothoracic Surgery at Children's Wisconsin, and professor and chief of the Division of Congenital Heart Surgery in the Department of Surgery at the Medical College of Wisconsin. He received his medical degree from Harvard Medical School, completed general surgery and thoracic surgery residencies at Brigham and Women's Hospital, and served as chief resident at Boston Children's Hospital for pediatric cardiothoracic surgery. He completed his fellowship in pediatric cardiothoracic surgery at Children's Hospital of Philadelphia, was at Corsair Children's Hospital in Louisville, Kentucky, and joined faculty at Children's Wisconsin and the Medical College of Wisconsin in 2006. Dr. Aoi Mitchell is a professor in the Division of Pediatric Cardiothoracic Surgery, Department of Surgery and Biomedical Engineering at the Medical College of Wisconsin and Children's Research Institute. She graduated from the Massachusetts Institute of Technology, where she majored in mechanical engineering and also received her PhD in bioengineering in the field of genetic toxicology. She completed a postdoctoral fellowship in pediatric cardiac genetics at the Children's Hospital of Philadelphia, was at the University of Louisville in the Department of Biomedical Engineering, and joined faculty at the Medical College of Wisconsin in 2006. And our parent panelists, Chris and Stephanie Wolf, have 2 children with congenital heart disease. Chris also has a CHD, and there is a history of CHDs in his extended family. Chris and Stephanie both have a background in engineering, which led to an interest in getting involved with researchers to see if their genealogy could improve CHD understanding and lead to better treatment for children in the future. Welcome, everyone, and thank you for joining us. Before I turn things over to Dr. Lincoln, a few housekeeping notes. Following the presentation, we will be answering questions submitted using the Q&A function at the bottom of your screen. If we do not cover your questions during that time, or if you have follow-up questions to a topic being discussed, we will make note of those questions and follow up as possible after the webinar. Our panelists will not address specific questions to your child or medical diagnoses, but will speak in generalities and provide relevant resources for families to learn more. As always, with the information learned, we encourage patients and families to discuss their specific concerns directly with their care team. And with that, I would love to hand it off to Dr. Lincoln for her presentation.
Thanks, Becca. Well, good evening, everybody, and thank you for joining us on this Tuesday evening, a warm Tuesday evening in Wisconsin at -5 degrees Fahrenheit. So thanks everybody for taking the time. We're really fortunate that Conquering CHD invited us to share some of the work we've been doing here at Children's Wisconsin in the Herma Heart Institute. Next slide, Becca, please. So I really want just to spend a minute just to introduce you to Children's Wisconsin, the Herma Heart Institute, for those that are not so familiar with us. As stated here, we are the largest pediatric cardiac care center for Wisconsin, and we're one of the best in the nation for our care. And we really have 3 basic principles that we follow. We want to be and strive to be, have the best patient care for every child that walks through our door with congenital heart disease. And we also want to provide cutting edge research to support our clinical care and really try to understand what it is about the underpinnings and etiology of congenital heart disease. How do cells move? How do cells talk to each other? And why is it that 1 in 100 children are born with a structural malformation of their heart? And lastly, we really strive to be leaders and educators in training the next generation of scientists, healthcare providers, community workers, and patient families in understanding what it means for their child to have congenital heart disease and what hope is there for the future. So with that, I'm actually going to hand over to Dr. Mike Mitchell, who's going to give you some more background on our clinical care. And Mike is our section chief for cardiothoracic surgery. And so he's going to hand it over to him. Thanks, Mike.
Thank you. Thank you very much, Joy. And this is just a tremendous honor to be able to talk to this group about our center, and also to share with you some stories about where we're heading with our research and our translational research. If we can go to the next slide. We are, as Joy had mentioned, we're the largest provider of congenital cardiac care in the state of Wisconsin, and have really a long and storied history of delivering that care just outside of Milwaukee. We are an international designation of care for some of the most complex cases, and serve patients from 42 states and 7 different countries. We perform 500 cardiac catheterizations a year, 300 open heart operations. We've done 240 heart transplants during the time of our existence. And we see over 10,000 cardiac patients, congenital cardiac patients a year. Next slide, please. I want to introduce you to 3 of these very special children, 2 very special adults, Chris and Stephanie, who are with us today, and 3 individuals with congenital heart disease. So it's a multi-generational process in this family. And I was fortunate enough to work with this family, a surgeon. Caleb is now 15 years old, but he had a form of an unbalanced AV canal defect and has gone through stage palliation, which many of, I expect people on this call have experience with, and has made it through a PA band procedure, and then a Glenn, and then ultimately a Fontan. Tyler didn't have congenital heart disease, but Emma did, and had a little bit more severe variant with unbalanced AV canal, really a hypoplastic left heart syndrome, and requiring a Norwood procedure, and then ultimately through Fontan. And now Emma's course was complicated by a number of required interventions, and their family has inspired us and supported both our clinical effort and our research effort so tremendously that 2 major projects have launched from it, and we're very happy to share with you some of that tonight. So if we can go to the next slide.
Thanks, Mike. So as Mike mentioned, we treat over 10,000 patients annually for congenital heart disease here at the Herma Heart Institute. And when we think about where are we current state, we think 30 years ago, our improvements are drastically better now than they were 30 years ago. And Chris and Stephanie can affirm that as well, of what would have happened 30 years ago if they'd been in this situation. So no doubt we are advancing our way forward. But every child that walks through our door with a congenital heart disease is brought to us for a different reason. Their reason for being born with a structural malformation of the heart is different. They have different genetic makeup. They have a different environment that they were raised in. There are many other reasons. We don't even know why they come through our door with a congenital heart defect. And so one question is, why are we trying to develop one treatment plan? And it's kind of like, if you think about, I think about getting a suit made. When you get a tailor-fitted suit, one size doesn't fit all. As human beings, we're all different. We have different dimensions. We're shorter, we're taller. And so why do we have one treatment plan to treat all these different cases of congenital heart disease that arose for different reasons? And so here at the Herma Heart Institute, we're really trying to think about, how do we tailor a personalized treatment plan to treat your individual needs. And so we've been known to call this a personalized and precision medicine. So that's really what we're striving to do here. And I wanted to share with you some exciting new work that we're trying to pursue here and build towards a treatment for congenital heart disease. So next slide, please. So the concept is simple. The execution, not so simple, but it's based on when we think about when we deliver our babies, it's based on having a patient's own umbilical cord or blood that we take during delivery. And that umbilical cord blood and cord tissue is highly enriched with stem cells. And stem cells, as you know, are very powerful cells. And the real goal about this program is that if we use the patient's own cell, the outcome of rejection when we implant those cells back into the same patient are very minimal because they came from the same patient. So it's a real advantage to start using patient's own cells in translational research to treat congenital heart disease. Next slide. And so, as mentioned, at the top, there's many different populations of stem cells that we can take from the umbilical cord or tissue. And here's just two examples of microscope images of stem cells that we can isolate. But the real power of having a stem cell is they have the potential to differentiate or transition into any specialized cell of the body. And that includes the cells of the heart. So here at the bottom, you can see all the different colors that shows the different cells of the heart. And so some of them are cells that beat, that make the muscle of the heart. Some of those are the vessel cells that form the structures like the aorta. And so depending on what environment you culture and really put these cells into, they have the potential to differentiate into these different cells. So once you have a specialized cell, you can then put them together and you can put them into a scaffold or any kind of sponge that the cells can stick to, and a group of cells will form into a tissue. And so if you go to my next slide, if you think about a vessel, we can then make these umbilical stem cells differentiate into all the different cell types that form the aorta, or the muscle of the heart, or the myocardium, or the atrium, or the pacemaking cells. And if you seed these cells onto different scaffolds or tissue engineering platforms, you can get them to grow into different structures of the heart. So this is what we have here. And Becca, if you can start the image on the left on the beating heart cells, hopefully this works, or maybe not. If you can go back one. So what I was going to show you on the bottom left is actually we can take these stem cells, we can put them in a very enriched environment that pushes them towards becoming beating heart cells. And what you would see here is a whole sheet of cells that we've actually put into culture, and together they synchronize and they actually beat to form a beating muscle cell. And then on the right, our other passion is really looking at how we can make these umbilical stem cells differentiate into heart valves. And that's based on the structure you see here, but these cells can be derived from these stem cells depending on what scaffold we seed them into. As I say, it's like a sponge, and we add the cells into these sponges and they grow around into their environment. So for now, our two focuses are taking these umbilical stem cells and trying to get them to differentiate into beating heart cells, as well as heart valve cells that we would then be able to implant back into the patient that we took these umbilical stem cells from at the time of delivery. So if you can go to my next slide, Becca, please. And so the concept, this is our kind of pipeline. And what happens is you would go to your fetal diagnostics clinic and you would have your echo, and you would maybe be presumably, in 99% of our patients, everything is fine. But for that 1% that are diagnosed in utero with congenital heart disease, you get told that, are there anything that we can do right now to help our outcomes? And there is one thing you can do. And one thing is that at the time of delivery, you can opt to bank your umbilical cord tissue and blood. And then in our program, this gets banked and is absolutely free of charge to families. So it gets banked under clinical grade. So if you bank a tissue or blood under clinical grade, that means it can then be put back into the patient at some point in time. So you bank this at clinical grade. It can also get banked under research grade so that we can then take this back to the lab and we can do our experiments and trying to optimize conditions to get the best possible heart valve made out of your stem cells or your beating heart cells that can then be transplanted back into your patient or your sibling, your child, at the time when corrective surgery is needed. And you go to my next slide, Becca, please. And this is really my last slide. And so again, this is a new concept that we are initiating here at the Herma Heart Institute, really to take care of our care during pediatric stages of congenital heart disease. So you have your pre-diagnosis, you would then opt to take your stem cell, cord blood or tissue. It would say get banked free of charge at no cost to families, and it will be stored in a clinical grade. So at some point in time, as and when needed, we could take your cord blood and tissue, we would isolate the stem cells, and then we would differentiate them into whatever structure of the heart is needed, depending on what your diagnosis is. For example, if it's hypoplastic left heart syndrome and you're in need of new beating muscle cells, we would take your stem cells and perform experiments to develop almost like surgical sheets of beating myocardium. Or maybe your child is in need of a new valve because of a congenital heart defect. And so we would take your stem cells and differentiate them into heart valve cells and form this generation of tissue engineered heart valves. The goal really here is to start reconstructing structural malformations of what your child is born with. And so this is really some exciting new studies that we have ongoing here at the Herma Heart Institute to really help advance the way that we think about personalized medicine and what your child needs for the next step to make better outcomes. And so with that, I really want just to finish with our contact information of the people on this panel today. Both myself, Dr. Mitchell, Aoi Mitchell, and Mike Mitchell are more than happy to answer any questions that you might have. Please reach out to us if you want to be part of this program, you want more questions on this program, and how can we help make decisions that you may struggle with and questions that you don't know the answer to. We're more than happy to help guide you through that process. So with that, I will end our presentation and hand it back to Becca for any questions and answers that the audience may have.
Thank you for that information, Joy. I think at the moment we have a pretty quiet audience. One thing I know our families are going to want to know is how far are you guys away from making this a standard treatment for kids with CHD?
And I'm happy to take that question. Please, Mike and Aoi, please join in. So where we are currently right now in our program is we have IRB approval to consent families that would like to be part of this program. And so if anybody's interested, they're more than willing to participate. One thing I will say is that you don't have to be a Herma Heart Institute patient family or be delivering a child here on campus at the Medical College or Freda Hospital here in Milwaukee. You could be anywhere across the country. The idea is we would send you a collection box and that would go with you to the time of delivery. You would then collect the sample during delivery and then you would FedEx it back to us at the Herma Heart Institute and we would store it under clinical grade. So we're at that stage where we're collecting samples right now. As you can see, we're heavily engaged in our research program and advancing, taking advancements of how we can use these stem cells to create surgical material that can then be placed into patients. Our next step is to get into clinical trials. And so that will be the more barrier or the longer term. So we are not ready to do this tomorrow, but we're hoping within the next 5 to 10 years that we'll be able to help some of our patient families on this call in the future. And this isn't restricted just to patients now. If you have siblings or you're thinking about having children and you didn't collect the cord blood on your first child, but you're thinking about it in the future, please don't hesitate to reach out. And Mike and Aoi, please add if you'd like to add anything else to that.
Yeah, I will just say that we, through the genius of Joy and Aoi, we've been able, the beating heart cells that I think that Joy was going to show are really from Emma, and it's pretty amazing because I would say we're at the prototype stage where those cells have been seated on a scaffold and you have actually a beating patch material that is potentially sewable. So as a very first line intervention, we have some of these incredible prototypes that our laboratory team has really been working on and developing that we're really excited about. It'll take a while before we get to clinical implantation, but there is a pathway for this.
One question from the audience is, how long might it take potentially to grow a valve?
So growing the actual valve is not the most difficult part. The issue then comes, so if we were to take a scaffold and seed our cells into the scaffold and grow the cells, we can do that relatively quickly. The hardest part is getting the valve to withstand the pressure and everything else it sees in a native heart. So we then have to do very stringent testing to make sure that the valve that we're going to implant in our patients is going to be able to withstand all the hemodynamics that go on in the heart. So actually making the valve is not the difficult part. It's having a valve that's resistant to all the complications that are going on in the hemodynamic environment. So that's where we partner with our biomedical engineering collaborators here at Medical College, and we go through very stringent protocols using bioreactors, mechanical testing to make sure that the valve that we have is going to withstand what happens when it gets implanted into a patient.
One question from our Facebook audience was the cost to families. I know cord blood banking can be really expensive for families, which is often a deterrent from people being able to utilize that function.
Absolutely free of charge to all our families. We don't want any barriers in the way that we can help families here. So anybody that enrolls in our program will have free of charge storage for collection, storage, and shipment of their samples to us. So this is at no cost to any family.
Stephanie and Chris, I'm curious to know kind of your feelings hearing all of this and what's coming out of it, and knowing you've been a part of it. What are your thoughts there? I think you're still on mute.
So, we've had probably about a 12-year relationship now with the research lab, because like Dr. Mitchell said, we got to know him back in 2006 when he put the PA band on first on Caleb, and then subsequently in most of 2010, Emma spent time at Children's Wisconsin. And having an uncommon family history, we kind of pursued the research side of things to see how we could potentially help the future of congenital heart defects. Since we couldn't really do anything necessarily for our kids at the time, we felt that, potentially our story and our situation could help the future. And so that's why we've stayed involved and gotten tremendous support from our extended family in donating blood, and we've given skin biopsies to further the tissue discards that are from surgical procedures. And it's been fascinating to see the ebb and flow of the different research projects and the results, and how going down one path can diverge and lead you into many more paths. And we're just really excited to see where this precision medicine goes, and even the potential in the future for even our kids.
I think that's great. And question to the rest of the panel: what does it mean to have this level of patient and parent involvement in this research?
Allie, do you want to answer this because you were so involved with the Wolves?
Well, it's just been such an honor to work with the Wolf family. They have truly inspired what we do daily. We are thinking about them every day, and it just keeps the entire team really driven and focused on what we do, recognizing that we've been very fortunate to have the incredible information and data that the Wolf family has kindly shared with us. And so it's our responsibility to make sure that the very best science, that this gets to the best science that we possibly can ensure that it becomes. we feel very fortunate to work with this team. It's truly a team effort.
Another question from the audience. Can an expecting mother participate in stem cell storage with your program at this time?
Absolutely, yeah. So anybody that's interested in participating, please reach out to one of us and we'd be happy to get you the consent. And this is really the audience that we're looking for. And as our research side goes as well, and even from a clinical standpoint, if people are known to be having healthy pregnancies, we also encourage them to participate as well. We're also looking for healthy controls as well as part of our studies. So absolutely, if there is any questions you have or you want to participate as an expecting mother or family, please reach out.
And just on that note, we will have links to these research lab websites in our follow-up blog, which will get shared with the participants as well. So if you have questions, you're welcome to email them to us and we can get them to the right people.
And we're so grateful that the Wolf family, they're so actively engaged and from the very beginning, and Ari and Mike work closely with them as well. And so they are always interested in what we do with their research and their outcomes. And so if families want to get involved in the research that we are doing here, we really do welcome, because this is what drives us each day to do our very best. And also we want to see this through and do what we can to help our patient families.
Another question along those lines. Let's say we are interested, but we're also from Canada.
Great question, Mike. I don't see this time I don't this time see the international barrier as being a barrier in this program. Anybody is welcome to be consented enrolled into our program.
Yeah, I agree. And there is no barrier that I know of to that.
Mm-hmm. No.
That's amazing. Another from our Facebook audience, can hypoplastic left heart syndrome be treated through growing parts from the umbilical cord of potential sibling umbilical cord blood?
That's a very interesting question. I'm going to leave some of that genetic detail to maybe Joy and Howie, but we're contemplating ways to think ahead, and the basic principle of this program is to recognizing that there's a lot of development to occur, to get ahead of that by making it possible to store and bank the cord blood, and then do both research in tandem with development of materials that we will be able to use at subsequent operations for that particular patient. But there may be opportunity to for one sibling to help out another. I think there are some limits on that too.
And one thing we're thinking about, is when we take our stem cells from patients that may have a genetic underpinning as to why they have congenital heart disease, which is what Ari Mitchell's lab is looking at. We think, how did these stem cells from these patients function? Do they function just as well as patients from families that may not have any genetic predisposition? So that's also ongoing. And as Mike alluded to, that's when we think about how can we utilize control, cells from control or healthy deliveries, as well as siblings that may not be carrying any of those genetic disorders. So this is all works in progress, but these are great questions, and they're at the forefront of what we're trying to do.
I'll say also that there's it's not just the creation of materials that can be implanted, that there's a lot of discovery work that's happening. And so genetic discovery work in terms of what is causing the defects, and then how much risk is associated with a given genetic alteration that's discovered. And so that's one of the things that we learned from the Wolf family participation, is that a particular mutation may put you at higher risk for ultimately needing a different type of intervention down the road. And so in this way, it's very clear that family members can inform other family members, and that it's really a multi-generational approach, as well as just the individual.
As part of this program, there's opportunities for us to take blood from, from mom, from baby, from family members, and look at, if people are interested in trying to really get at what's the genetic etiology of, is there a genetic underpinning of why my child was diagnosed with congenital heart disease. So this is when we talk about precision medicine, and we think about how do we really look at the whole complexity in the package that really underlies why the structural malformations occurred, from genetics to environment, risk factors. This is all of great interest to us.
Yeah, I think that's something that basically all of our families have struggled with at some point, is what caused this for myself, my patient, my kiddo. So I think having some of those answers potentially on the forefront is amazing. Another question, are there other groups who are trying to do stem cell therapy with regard to CHD? If there are, how does your program differ?
A great question, and no doubt we're not the only group doing this. We are, though, one of very few that are doing it, especially in pediatric patients for congenital heart disease. Many of the stem cell studies out there right now have looked at adults that have suffered from heart attacks, and they've had or injury or damage to their heart, and they've been able to directly inject stem cells into the site of injury and look at how those stem cells matriculate into the native heart and help replace the damaged cells. So we're taking a slightly different approach in our program, because we're actually looking at congenital heart disease and finding ways that we can use research to build cells and tissues of the heart, which would then get implanted. So slightly different approaches. So that's what really makes us unique. I think one other thing we have really on campus, we're very fortunate to have, and I think Michael to us, it was a real team effort. And on site, we have our engineers, we have our surgeons, we have our pediatric cardiologists, we have geneticists, we have our molecular biologists, all within, on campus here, within a footbridge walk to each other. So we're fortunate that we have a one-stop shop for this, and we're fortunate that we have support, that we can do this free of charge to our families. And so there are other groups doing this, but our approach in the pediatric population is unique to other programs.
And I'll extend on that too, and just say that we really are looking, our strategy is one about providing surgical materials that may be of benefit. So a number of other groups have done stem cell injections with the hopes of improving cardiac function through that means, or seeding of the myocardium with using other techniques. And we're looking at building scaffolds, relatively simple scaffolds that we can then take and use at the next intervention, hopefully. And that's what we're looking at right now. So it is different.
One question I'm sure will come up as people watch this moving forward is, I may have already banked my cord blood somewhere else. Can I still take part? For myself and my husband with our hypoplastic 4-year-old, we banked our cord blood with another program, and it doesn't offer this. And at some point it starts charging us after the 5-year mark. So is there opportunity for families who have already banked their cord blood somewhere to take part in this program?
Yes, definitely. In most situations, when you bank your cord blood with a national biobank, you still own those samples yourself. You're usually paying for them. And so providing you own those samples, you have every right to withdraw them from that bank and enroll them over into any other bank that you would like to do so, one of which could be the one that we have here at our program. So yes, that is an option for families that may have already banked within a biobank and are currently paying for that.
Great. Chris and Stephanie, do you have any advice for parents who might be exploring this particular program, or for participating in research in general?
Sure.
So as far as this particular program, I mean, we were obviously, our kids are older now, so they didn't have this program when we came through, and that would have been great if it had been available to us. I think we would have been very interested in it, just for a number of reasons. And you know, what Stephanie said earlier about why we got involved in research and those types of things. what was the second half of the question?
Advice for participating in research.
Oh, yes. So for sure, especially, my family, my extended family has had a number of heart defects in it. I had a coarctation. And so I definitely was, when we had 2 children that had it and we knew my history, we were very passionate about getting involved. And we had a couple of different routes. We had more genealogy type route and then the more of the research side. And as in, being engineers ourselves, we were definitely drawn more towards the research side where we were hoping that we could improve the outcome of others. We didn't know, and knowing how long medical improvements take, we didn't really anticipate that it would truly help our children. But if it did, that would have been great. But we definitely thought that there was something here, and we were hoping that we would be able to improve outcomes for other kids in the future. And so if there are other opportunities for people to get involved in research, I would definitely encourage them to do so, because I think that having a collaborative effort with the right people and the mindset of the Mitchells and Joy, I think you really can make a difference in the world. And so that's, where I think I see things going.
Thank you for that. I think that's one thing that we try to promote with Conquering CHD is how important research is, not just for the patients today, but the patients coming after these kiddos. So thank you for sharing that perspective. There's another question from our Facebook audience. Can you use donor stem cells to help create these materials for other patients, or do stem cells have to be from your own family member?
Yeah, it's a great question. They don't have to be, but you have to be able to tolerate somebody else's stem cells if they're going to be implanted into your body. So autologous is ideal because the risk of rejection is very minimal, but there are certainly cases where you can take other people's stem cells, and there is immune therapy, so you can sometimes dampen down that rejection. But in most cases, autologous is best, but there are some possibilities that you can take other people's stem cells and we can develop. And even if people want to donate to the program and use their stem cells for research purposes only, that's also a huge asset for us and the whole program of how we can really get to understand how we can improve current treatment strategies in the treatment of congenital heart disease.
Great. I don't see any other questions at this point. I think if you guys have any kind of closing statement, anything you'd like to add that you think would help patients understand this process a little more, help them get involved, etc., I'd love to hear your closing thoughts.
Well, I'll start by again thanking Chris and Stephanie for their involvement with us over all these years. They opened up their family to us in the sense that Allie and her team were able to draw blood and interview and develop a family tree that really allowed a lot of the discovery work that inspired a lot of this effort. And so I would like to just thank them again for their participation. But in terms of the technical aspects of how you get involved with our program, I think I'll turn it back to Joy to maybe outline that.
Thanks. And I just want to reiterate thank you to everybody's on the call this evening, giving up their time. And I know everybody on this call is on here for a reason, for whatever way in which congenital heart disease is impacted on their lives. So thank you for taking that time. So I really want to close by inviting people who are interested to reach out to us. There is no obligation, there is no cost, there is minimal risk to the program. We know and appreciate this is a very difficult time for families during delivery and the collection of the umbilical cord, tissue and blood, but we really don't want this to be a negative situation. So this is a very straightforward protocol, and people that are interested in joining our program, we really do welcome anybody that wants to enroll and be consented. Please reach out, and there's no silly questions that are going to get asked, because we're happy to help anybody. So thank you.
Anything to add, the Wolf family or Owie?
I just wanted to thank the audience and all of the panel participants so much for the opportunity to be here this evening. And again, to the Wolf family for truly inspiring us these many years. And to Joy for really showing us where the future can go. We're really excited about the vision of this program. And thank you, Becca, for organizing this. It's been great.
Yes, thank you, Becca.
I think it's always really exciting for us at Conquering CHD, and then for heart families everywhere, to hear the advances and what's coming next and what the possibilities are. So thank you all for sharing. As we wrap up this evening, I would like to thank all of you guys again for joining us and for contributing to such a thoughtful and interesting discussion. This presentation was made possible by our partnership with the Herma Heart Institute at Children's Wisconsin, and we'd like to thank them for their continued support of our mission to conquer CHD through direct support and educational webinars like these. For the recording of this CHD Wise episode and all of the information referenced in tonight's presentation, please visit us at conqueringchd.org/learn/CHD Wise. Until next time, good night.